back from my walk this morning and I was already triggered by the internet. So there's this influencer with thousands of followers and they're holding up a bag of vitamin D3, 10,000 IUs, and they say you have to take it with K2 because it'll calcify your arteries, and you also have to take it with magnesium glycinate, it's glycinate, because that's the only one that crosses the blood-brain barrier and that helps vitamin D absorb. Okay. So let's just do some debunking because I'm a registered dietitian. I've done this for almost 10 years. And I feel like half of my job is actually just caring about people and debunking things on the internet so people don't hurt themselves. Because we relate how many followers you have to credentials, apparently. So, okay, vitamin D3 does need K2. Yes, we will get into that. Magnesium glycinate is not how you say it, and it's not the one that crosses the blood-brain barrier. It's L-threonate crosses the blood-brain barrier, and there's nothing to do with what she's saying with crossing the... Why does that matter with vitamin D? Anyway, so vitamin D3 is not active. It's not the active vitamin D. When the sun hits your skin, you have 7-dehydrocholesterol, and that converts to cholecalciferol. Cholecalciferol is the D3. That's where we get it from the sun, and we get it from supplements. It's still not active. All right, so it travels to the liver, and it goes from the cholecalciferol to calcidiol, and then it goes to the kidneys, and from the kidneys it goes from calcidiol to calcitriol, which is the active form of vitamin D that binds to VDR, the vitamin D receptor. Okay, K2, especially MK7, that's the one that you want to look for. MK7 will actually help direct the calcium in your gut. Vitamin D helps calcium absorb in your gut. You're eating an adequate amount of vitamin D if you're not postmenopausal, if you don't have osteopenia, osteomalacia, osteoporosis, and you don't need additional supplements of calcium. I do not recommend supplementing calcium in the first place unless you absolutely need to, because vitamin D can actually enhance the absorption of calcium, so you're actually absorbing more calcium from your food when you have the vitamin D. D3, you want K2, and when she's holding a bag and it says 10,000 IUs, you need to get your labs checked first of all. Who would do that? Who would put that much vitamin D in their body? First of all, you can't absorb it that much at a time. It's not like the more you throw down your throat, you're just going to be absorbing more. That's going to throw off, your parathyroid's going to freak out. It regulates calcium and vitamin D in your body anyway. So you have to work with your body. If your vitamin D is low, I always recommend BID. So you want to divide your doses. Typically, depending on what your levels are, I want your levels to be over 40. That's just what research is showing for optimal levels is over 40. When you're taking just to help with the cold and flu season, you don't have a doctor, there's no way you can get labs, a safe dose would be around 1,000 to 2,000 IUs a day, okay? So 25 to 50 micrograms with about 50 to 100 micrograms of K2 in the MK7 form is what I usually want to look for. Calcium, you're going to go to the bone and the teeth. You're not going to go to the soft tissue and the arteries. So you stay over there, I'll help vitamin D, and that's kind of how it works, and that's how I describe it to my patients. Calcium and magnesium are both absorbed in the gut, and they're going to compete. And magnesium is just going to be kicked to the side, and you're likely going to start having a magnesium deficiency, especially if you don't have magnesium in your food. So, with that being said, it's a lot to unpack, but it should be. It shouldn't be clickbait, or in my case, rage bait, because it's just wrong. And these poor people will come to me, and I have to help them correct what's wrong with them because they listen to someone on the internet. And it's not just something that you can pee out. It's a fat-soluble vitamin. So it's a pro-hormone with that. So, it really does depend on what your labs are, and I would highly recommend starting there. And like I said, if you can't, there are signs and symptoms of vitamin D deficiency. We often say depression, fatigue, those are the first ones. It's like, okay, you're likely vitamin D, or lower back pain, joint pain, bone pain, that can start there too. With magnesium deficiency, it's not, what we often see is like the muscle cramps and things like that. That eye will start twitching. You'll start having a little weird eye twitch. Just little things like that before it's like a full-blown deficiency. Now, how much do you need? That depends on your lab levels. 10,000, you don't need 10,000. If you are truly deficient, then speak to a dietitian, speak to a doctor that knows about these things, because if you're taking that for a long time, you're going to throw off your parathyroid. Your body's going to be like, whoa, I didn't need that much. Now, depending what the levels are, like I said, a normal dose, if you're just trying to get through cold and flu season, is going to be around 25 to 50 micrograms, 1,000 to 2,000 IUs a day. You want to take that with a healthy meal, with a healthy fat, because vitamin D and vitamin K are fat soluble. So if you're just taking these in the morning and they don't have any like olive oil or coconut oil in them, you want to take them with a meal, because they are better absorbed that way, and you don't want to just waste your money. If you're taking more than 2,000 IUs of vitamin D a day, you want to start dividing that up. I usually don't recommend taking vitamin D at night, because if someone's truly deficient in vitamin D, they're going to be wired, and that happens to me anyway. I have GC and VDR, the genetic variant, so that's a little different. But with that being said, you want to split those up, so like morning and afternoon, for example, if you need it. The magnesium glycinate, it is an amino acid glycine, and it's bound, so that's where the glycinate comes from. The more magnesium you take is not always the better. You want to divide that up. Just like the vitamin D, you want to divide that up. Now, with magnesium, if you're taking 400, 500 milligrams, you're going to start absorbing less than 30% of it. So the more you take, you're actually absorbing less. So I typically recommend 100 to 200 milligrams twice a day. And it really depends on the type that you need. Magnesium L-threonate is going to be the one that's going to help with brain health and anxiety in a different way than glycinate is going to. Glycinate help with anxiety, and it's a wonderful form to increase your RBC magnesium, and it's also shown in cardiovascular disease, diabetes. So I'm not knocking glycinate. That's probably one of my favorite just all around forms. Now, if someone has muscle fatigue, muscle pain, that's why we have Epsom salt to get in the bath. But malate, like for fibromyalgia, taurate, there's citrate, there's oxide, there's a ton of different forms. And so it really just depends on what you need with the magnesium. And you can also look at your nails. Your nails are wonderful, wonderful for looking at deficiencies of protein, iron, zinc. Hopefully that clears up some things for you guys, and you enjoyed my rant, because it's free.